Hi everyone, my name is Timna Ekschmidt. I am a research analyst at CORD, the Center for Humanitarian Logistics and Regional Development, which is a joint research center by the Kuehne Logistics University and Help Logistics. My team includes Professor Maria Besu, Jonas Stumpf, and Kaspar Höing. And together we are working on a project with the title Towards Universal Health Coverage, Strengthening Healthcare Supply Chain Resilience to mitigate the impact of epidemic outbreaks. This is an ongoing project and it started in the beginning of 21. And we're collaborating with the World Food Program, and this project is generally funded by Takeda Pharmaceuticals and the Bill and Melinda Gates Foundation. At the World Food Program, we are collaborating with the Health System Supply Chain Strengthening Team, which includes Silvia Rosita Furi, Ilse Larkin, Lies van Wassenhove, and Athena Badia. The World Food Program is recognized as a leader in logistics and is traditionally called upon to respond to large-scale emergencies such as epidemic outbreaks through the interagency services. And for the World Food Program and CORD are now collaborating to better understand the complex behavior of healthcare systems and the interconnections between universal health coverage and epidemic response. In 2015, the UN Sustainable Development Goals came into force and were adopted by 193 countries. While most of these Sustainable Development Goals have an impact on people's health, Sustainable Development Goal number 3 really focuses on good health and well-being for all. Within this goal, there are 2 targets that are being defined, which form the backbone of our study. The first target is universal health coverage. UHC aims to provide availability of and financial and geographical access to essential health services. And the second target is to strengthen the capacity for early warning, risk reduction, and health emergency preparedness. Both those targets rely on a functioning primary healthcare system, which is recognized as the foundation for universal health coverage. Supply chains are also fundamental for PHC because they ensure that the right product is in the right quantity, at the right place, in the right time, at the right price, under the right conditions, and of course, then at the right patient. Unfortunately, in many countries, healthcare supply chains are rather weak and have difficulties in fulfilling patients' demands and needs. Besides these difficulties, they're also generally more vulnerable to disruptions. Disruptions can be small scale, however, there can be also large scale disruptions such as epidemic outbreaks, which then have a significant influence on the primary healthcare system and its supply chains. To reduce this impact and to ensure continuous availability and access of healthcare services, strong healthcare systems need to be in place. Over the recent years, there has been a growing recognition that supply chain resilience plays a key role in this and in health system strengthening. Recent epidemic outbreaks, such as the West Africa Ebola outbreak or the COVID-19 pandemic, have revealed tremendous operational bottlenecks and disruptions of healthcare services in both primary healthcare services and then also in epidemic response supply chains. The sheer extent can be seen for example, the limited access to essential health services, clinical staff for deployment, there has been insufficient PPE, significant price increases and delivery delays, stockouts, funding diversions, and of course also disruptions in other healthcare services, such as disruptions in HIV, malaria, and supplementary feeding services. This also has a significant effect on people's health. For example, during the West Africa Ebola outbreak, the mortality rate of tuberculosis patients has been estimated to be increased by 57%. These outbreaks also have long-term consequences. For example, the loss of trust in the healthcare system, economic impact, and food insecurity, which then again have feedbacks on the healthcare system. Weak healthcare supply chains were particularly affected by these outbreaks, which demonstrates again why supply chain resilience is so important. The definition of supply chain resilience that we are working with in this research is the following. Supply chain resilience is the adaptive capability of a supply chain to prepare for and or respond to disruptions, to make a timely and cost-effective recovery, and to progress to a post-disruption or improved state of operations. Supply chain disruptions are unplanned and unanticipated. They can be extraordinary or recurring events and have in common that they disrupt the normal flow of goods and materials within a supply chain. They are also seen as an inherent property of supply chains, and in many cases, supply chain disruptions cannot be prevented. And therefore, it is so important that supply chain resilience doesn't only focus on preparedness measures, but on the effectiveness of preventive and reactive strategies to disruptions. This leads me to our problem statement. In this study, we aim to understand the key parts of public healthcare supply chains that are vulnerable to epidemic outbreaks. We are analyzing the health system's bottlenecks, its capacity constraints, and its general resilience to epidemic outbreaks. And by doing so, we aim to find leverage points for preparedness investments. Both preparedness and resilience of healthcare supply chains are essential for healthcare system strengthening and then for ultimately reaching universal health coverage. In our research, we're using a system dynamics modeling approach. System dynamics is a perspective and set of conceptual tools that enable us to understand the structure and the dynamics of complex systems. Using system dynamics allows us to evaluate the resilience of public healthcare systems, to analyze the impact of epidemic outbreaks on the supply chain, and also to simulate the effects of preparedness investments on the healthcare system. We intend to implement this model in various case study countries to draw from a wider perspective and set of findings. What elements do we have included in the healthcare supply chain resilience model? Structure-wise, we focus mainly on manufacturing, on actors within the public healthcare supply chain, on actors within the epidemic response supply chain, and on healthcare programs. The main capacities we're focusing on are supply capacities, storage, transport, and financial capacities, as well as healthcare workers and service delivery or treatment capacities. As mentioned, system dynamics allows us to simulate various strategies, and we are focusing on the reduction of the transmission of the disease, the governance of competition for supplies. We look at the decision-making within the prioritization of capacities during the outbreaks between the response and the primary healthcare supply chain. And we're analyzing and simulating preparedness investments and their effect on the public healthcare supply chain and emergency response supply chain. In our research and in the interviews that we have conducted so far, we could see that unfortunately, relatively few healthcare authorities engage in supply chain preparedness to epidemic outbreaks and rather respond on an ad hoc basis. Prior studies have shown that supply chain resilience and supply chain preparedness investments can lead to a higher efficiency and effectiveness of emergency response. Our research team has drawn some preliminary findings from a simulation of supply chain preparedness investments in the humanitarian sector. The areas of investments are based on a supply chain preparedness framework by Marianne Jahre and her team, and are distinguished between intra-organizational and inter-organizational preparedness investments. Our team has focused on inter-organizational investments such as management control, including HR and information management, and then also logistics operations such as procurement and warehousing, which would then, for example, be supplier management or pre-positioning. Inter-organizational preparedness investments focus on the local response network. And here we are focusing on the collaboration and capacity building with communities, and local governments. What we have found for this simulation is that supply chain preparedness can lead to significant lead time and response cost savings. This graph here shows the return on investment of response costs and the lead time savings based on the disaster time. The disaster time signifies the day after the start of the investment in the operation when the disaster strikes. What we can see, for example, is that on day 450, we have achieved 22% of response cost savings. So in the simulated example, this would be almost 400,000 USD of savings, a bit over a year after the start of the investment, if the disaster then strikes. We can even see more significant effects of in lead time savings, because it gives us a 66% saving of lead times. And that would be, for example, 67 days save of lead times after the start of the investment. In our model, we're translating this analysis to the healthcare sector and are expecting to see similar positive results of supply chain preparedness in the healthcare sector and on healthcare systems. So what do? We analyze public healthcare supply chain resilience to epidemic outbreaks with the motivation to support informed decision-making regarding supply chain preparedness investments and to then ultimately increase the resilience of public healthcare supply chains to reach universal health coverage. We are using a system dynamics modeling approach and are intending to implement this model in multiple case study countries. Our preliminary findings show that public healthcare supply chains are generally poorly prepared for epidemic shocks, and that investments in supply chain preparedness can really lead to significant cost and lead time savings. This is a foundational research, so our findings can be confirmed using quantitative empirical testing. And this model can be further extended to incorporate linkages between universal health coverage and epidemic outbreaks. Thank you.